So, hello everyone. This is Nilesh here again on Healthcare Musings.
How I jokingly introduce myself is that I make babies for a living.
We as company are also very much pioneer in healthcare technology development. We work with a lot of US based healthcare systems, practices, hospitals, caregivers to build platforms for them. We are working on chronic care management, remote patient monitoring, cardiac implantable devices, remote monitoring of implantable devices. We are also working on robotic spine surgery, complete robotic spine surgery module. But I do not see those kind of systems coming up in the market. What is your take on that?
We are gradually improving in terms of medical equipments, in terms of health tech devices, in terms of technology. We are gradually getting better. When you talk in terms of robotic surgeries, probably which was the access to robotic surgeries, which was limited to 10, 15 hospitals 10 years ago, is now in hundreds.
So, hello everyone. This is Nilesh here again on Healthcare Musings. So, since starting the podcast, I have been speaking to many healthcare leaders and enthusiasts, and it has been a very enriching experience, networking experience, and enriching learning experience. But I had one thing in mind that I wanted to have a guest from Indian market, and guess what? So we have Dr. Saarthak Bakshi, and he is running IVF clinic, but not just IVF clinic. He's an investor and actively working in healthcare, health check, I would say. So welcome, Dr. Bakshi, and why don't you tell more about yourself?
Thank you, Nilesh, for having me on your wonderful podcast. It's a pleasure to be here and interact with you. So, how I jokingly introduce myself is that I make babies for a living, and by that I mean that I'm helping people with infertility. I run a chain of fertility centers across North India, Nepal, Bangladesh. We have a few centers across that. Apart from the baby making business, we are I've been very enlightened, I would say, and lucky enough to be part of the startup ecosystem from 2017-18 onwards. I've invested into a lot of companies. I've seen them grow. I've seen them die. I've seen the whole life cycle. I started with health tech because my area of expertise and my domain expertise was in health. Now I've become sector agnostic, but I've seen the whole journey and I've been through with a lot of people. And it's been a very enriching experience, very learnedful, and there is still so immense scope. I mean, from an Indian perspective, the population is huge, the health challenges are huge. You name it. I mean, there is no dearth of things that you can do in health tech. So we'll tell that later, during our talk and discussion. But it's amazing to see what the Indian subcontinent has to offer in terms of health and its applied sciences.
Okay, great. Thank you, Dr. Bakshi, for introducing. I have observed that many healthcare specialists who are working in core healthcare,
Yeah.
as you are working in IVF clinics, but they are not health tech savvy. So, but it seems that you are very health tech savvy. So, how did that come into you?
Purely with how you've grown. Like if you're speaking English, you've been taught English from nursery, we've been conversing in English, likewise Hindi, or if we start using computers. But if you're like saying, if we are used to writing exams on a piece of pen and paper, and suddenly we are told to write on computers, the speed won't be same. It'll take time, you can't make if you're making typing mistakes, it's all of that. So for doctors generally, they go through a very long cycle. It's like a 10-year study cycle minimum. Can extend between 10 to 15, including their internships and super specialization included. In all that time, you are speaking to a patient on a daily basis, multiple times throughout the day, on a pen and with a piece of paper and pen. Nowhere is this tech savvy data oriented system where you have to, the patient comes in, you put in some data, you're seeing a chart, the patient comes in with this big file, multiple reports, the doctor sub sees the reports, and then if there's an x-ray, sees the x-ray, if there is this, sees that, sees multiple things, and then takes out his piece of paper and starts scribbling, oh, this is my opinion, blah blah blah, here it is to you. So you see that there is no tech involved, or there's no even, from a very simplest point, tech becomes a very big word. The interaction is all manual.
Mm-hmm.
So the challenge lies that to solve, for a doctor to become tech savvy, you need to start actually building the basic technical capabilities from a doctor perspective. Their capabilities just lie in giving a presentation, as in a medical journal examination, that they have to present, and that's the technical thing. The PowerPoint is the only technical thing. For them, Excel, even Word files, that also becomes huge.
Mm-hmm.
So technically it's like how we are ingrained to see patients and what you do and how you're doing it. So the challenge lies from the basic education itself on how medicine is being treated in India. And I mean, it's completely different to abroad and everything, where there are no pen and paper. Every prescription is, okay, you come in and the doctor starts filling up data on the computer itself. Okay, what's your weight, what's your problem, your symptoms are this, and you're accessing all of data. Though although it's improving when in corporate hospitals, where there are people to help the doctors fill in that data, there are people who can actually take down these notes for you and then present to the doctor. So all that is improving, but we are miles to go before we can actually call any doctor tech savvy or do anything technologically be helpful in diagnosis.
So what sparked health tech interest in you?
Oh no, so health tech. Oh, I've been, I believe, so for me, technology is an enabler. It just whatever you want to do, say X times. If you want to solve that challenge 100x, and if you want to scale that, it can only be done through technology. I don't believe that, if you have a solution to some problem, the solution is hiring a thousand salesperson or thousand customer people to keep on solving, taking calls, and doing, answering the same question again and again, or taking your product or service for the solution that you've created, and then trying to keep selling that again and again through thousand salespeople. That doesn't help. If you have a challenge, if you want it to be solved at scale, if you want it to be accessed globally, that can only be done through technology. And for me, that's the biggest enabler, that you need to have that technology as the go-to thing. So that was my interest, that never ever can you actually think of solving something on scale without the help of technology. And as I was mentioning before, that since doctors are aware to technology, they run away from it. It's like, okay, if you, even if you have reports, come and show me your reports. Don't even send it to me on WhatsApp or something that I'll keep on scrolling and scribbling. Okay, ऐसा करना, कल अपनी report लेके आ जाना, मैं देख लूंगा. This is the most common answer you will get. Even if you are suffering from anything. अच्छा क्या हो रहा है, क्या हो रहा है, अच्छा आपने अपने को खुद की, if you seen your pulse, blood pressure नापा, ऐसा करना, कल आना, कल मैं चेकअप करके बताऊंगा क्या है. The most common answer. We are living in today's world where we are used to get all solution at the click of a button. Yeah, there is some or the other app, you press the button and you'll have a little bit of solution that you're wanting, from logistics to shopping to any other food to any other consumer product. But in health, you can never have that. I have never seen anybody go for an app and click on it. Okay, I am big simplest problem. If I am having fever or an headache, a paracetamol can solve it. But I will still not open my smartphone and open an app and think of going to either NetMed or PharmEasy or one engine thinking of paracetamol. पहला कॉल ही जाएगा डॉक्टर साहब को and try and so you can just see, from my perspective, where I feel that we are lacking big is that compounding effect where health is still seen as a challenge, and solving that health problem seems a bigger challenge with technology. So that is where my curiosity got the better of the cat, and that is where I was interested, that how can even small little challenges be solved through health tech, which actually constantly, to truthfully speaking, remains to be solved in India, since we are nowhere
Mm-hmm.
close to solving any of the challenges.
But don't you think that in India we have a very easy access to a doctor? Like we just pick up the phone and call the doctor. But
Yep. Yep.
if you talk about US or any other developed country per se, it is
Yeah.
very difficult to catch hold of a doctor. You have to like
True.
book an appointment, and then you will get
Yeah.
uh, to a consultation appointment after maybe 10 days, 2 weeks, 3 weeks. But
Yeah.
in India, it is very easy to catch hold of a doctor and get the consultation.
Mm.
So
Yep.
as an industry insider, what do you think that where is the industry, the healthcare industry in India at this moment, and where it is heading towards?
So when you're saying that an accessibility issue, we don't have that accessibility issue. I take it as a positive that the access is easy. A lot of my friends who are studying, working abroad, or even in our industry, who are actually delivering their babies. For them to see a gynecologist, which is very easy in India. You just, as you rightly said, they're just a call away, and you come and see. Over there's like a 1 2 month waiting appointment for a gynecologist, which you may not fathom. Why? What? I had to get an appointment. I mean, who else will she? Who else will a patient see? They'll actually go to an ultrasound technician for the ultrasound. The doctor does not do it. They'll actually go to a generalist rather than going to a gynecologist. Gynecologist comes into the picture when there's actually some problem, not like a regular checkup. And that's like the system that you're mentioning, that the accessibility is not there. Whereas in India, we are fairly accessible and easily accessible. So I don't think that being accessible is the challenge. I think the issues, because there are three things which make Indian healthcare system great. One is the awareness, second is the accessibility, and third is the affordability. All these three things make Indian healthcare system great. But when you come to the other aspect of it, with our population, with our medical problems and the health challenges that each individual is going, those are multiple at critical levels. So like in any other country where there's a population of 100 million, their health challenges for even 10-20% of the population is for 20 million. But at 1.42 billion people, our healthcare challenges is for around 600 million people, 700 million people. So you can see the amount of stress in the system that is already on the Indian healthcare system to solve challenges. You yourself know that we are actually the capital, in terms of healthcare. We are the diabetes capital. We may be the obesity capital, tuberculosis. There are these kind of diseases don't even exist outside. For them, in US, in Europe, there is no tuberculosis. Diabetes is rampant in India. 50% of the population is pre-genetically disposed diabetes. Multiple other things, as you can see, oncology, it's becoming rampant. Cancer is being spread rampantly across, for and everything related. When you don't understand something, and this is the answer that I am also guilty of telling. When you don't understand, stress, you're having hair fall, you're having infertility issues, and there is no direct correlation to a disease. So it's stress. And Indians are the most stressed. When you talk about this work-life balance, no, probably we don't have that because we have such a big competitive population, vying for jobs, businesses, and everything. The stress automatically comes into the system, which isn't bad. But the other factors which are not supporting India, the pollution, the environment, the dust, the chemicals, the movement of, from a very natural organic food to an artificial inorganic laboratory grown food. So all these factors have compounded into Indian healthcare system being stressed more with multiple forms of diseases which were probably not existing 30-40 years back. These amount of diseases, and all because of all the other factors that have now crept into, is making our population more disease prone. And that's why you'll see many people having hair fall, even in their mid 20s, as young
Mhm.
as that.
Yeah.
People are facing hair falls, if not hair falls, gray hair or white hair at in within 20s level. uh, Even for women, when you would think the menstrual cycles would start at 14, 15, they're starting as early as 10, 11. So the body itself has been changing because of all the factors which are not in your control or my control. That's the environment, the pollution, the chemicals, everything induced together. Whatever hormonal changes that we are undergoing in our body, that can't be seen, and how that it affects takes in the long term. Probably it's taken like 20, 30 years for these effects to kick in. But you can see with our generation what is the what effects it's having, from obesity to
Mm.
dental problems to multiple skin issues, multiple things.
Agree, agree. So I know you must have compared different countries how they work in healthcare. We as company are also very much pioneer in healthcare technology development. We work with a lot of US based healthcare systems, practices, hospitals, caregivers to build platforms for them. So I do not see much of those platforms like we are working on chronic care management, remote patient monitoring, cardiac implantable devices, remote monitoring of implantable devices. We are also working on robotic uh, spine surgery, complete robotic spine surgery model. But I do not see those kind of um, systems coming up in the market. What is your take on that, on this particular technology advancement which we see in the developing countries, but it is not coming or adopted in India?
So Indian system is gradually getting better. When you talk in terms of robotic surgeries, probably which was the access to robotic surgeries, which was limited to 10, 15 hospitals 10 years ago, is now in hundreds. The Da Vinci robot is actually there in many corporate hospitals, easily accessible, and even in non-corporate hospitals. Talking about chemotherapy or proton radiotherapy and all of that, we have access to them in India also now. uh, we are gradually improving in terms of medical equipments, in terms of health tech devices, in terms of technology. We are gradually getting better. But when you're talking in terms of, are we at the forefront of medical innovation? Would we have the latest technology? We've always been adopters. We haven't been inventors, or we are not. India is not known for R&D. The other way around. Right? Did we invent MRI, or have we improved the MRI from 1.5 Tesla to 3 Tesla? Did we do that? Did we invent certain form of proton therapy to, eradicate a disease or do something? No, we're not doing that. But as I'm saying, in terms of adaptability, we're gradually getting there.
Mhm.
So for me, it's always been because we are developing. It's a game of access to capital. It's a game for, do we have the patients who can actually, when you're talking about robotic surgery, it's being included. The system is growing. It's, as you said, that abroad everything is insured. Everything is done through the system, that you're part of the system. In UK it's the NHS. In US everyone's insured, basic level of insurance, or or something. Even if you're a caregiver or any other job, it's all done through insurance. Otherwise it's not feasible for anyone to pay for the insurance, or to get the treatment. But when it comes to India, it's the opposite around. Hardly our population, 10% or 20% of the population has health insurance. The 80% actually relies on either free government service or through out of pocket expenses, or through pure cash. So when you talk about introduction of any big medical equipment, or any fancy, not even fancy is not the right word, but anything that is extremely new in the market, but it's an expensive form of treatment, is an Indian, as an Indian citizen, are you ready to actually pay probably those lakhs of crores of rupees for treatment? Or is your mentality in relation? If I have to ask you the question, if you have, say, let's take a hypothetical figure, if it would cost you 1 crore rupees for treatment, would you actually pay 2 crore rupees and go abroad and get that treatment from the US, or would you actually like paying 1 crore in India and get that treatment,
Yeah,
assuming that you can afford both of them
yeah,
easily?
yeah, I understand that. It is, and I think the if we talk about any other market, like specifically US, where we work primarily, that is very much regulated market, regulated in terms of lot of checks and balances are there. Everything is integrated, interoperability is there, insurance is integrated in the whole system. So anything, whatever doctor
Mm.
performs is being paid by the insurance through a billing
Yeah.
system and billing code and everything. So I don't know if in India people are using ICD or CPT codes for any kind of whatever work they do, but in US everything is classified. But
No,
I
way
think
more
that,
regulated, as you said.
yeah, way more regulated. I think we will since we are, as you said, that the Indian system is heavily stressed because of the population, the type of or variety of disease which our doctors encounter. And spread of people all around, it makes it more difficult to make it regulated. But definitely when we talk about technology, I think we are in the forefront of actually developing technology. All the technology in the world is developed by Indians, if we say that. But yeah, definitely you said it, we are not the inventors, we actually help others to create the technology. uh, so now I want to talk about your involvement with different startups, and I know you have been into a lot of startups and health tech oriented or focused startups. So can you tell more about what you are doing in the startup space?
So, as someone in the healthcare industry, I was very inclined to help, leverage my network, help people, getting connects if you want to do something. So, if I would go back 4 5 years down the line, and mostly people who were solving this health tech challenge, the bridge between, and this is was my major concern, for everyone. Health tech meant patient and a doctor and just connecting both of them. This was 5 years ago. This was a health tech queue, right? I There's a doctor, there is health, but how do you know this is the right doctor? This is the nearest doctor. How do you get easily access to them if you want a video call to them? How do you get that data into something? This was health tech 5 to 7 years ago. We just have to bridge this divide, doctor patient communication gap. This is health tech. And this was the challenge that almost all the startups were solving. We have to bridge this doctor patient divide. My basic question whenever I used to encounter these entrepreneurs was, have you actually spoken to the doctor? That is there a divide? From a patient, the perspective would come up. From a customer, the perspective, and I don't know what the doctor is. I may need to call my relative and ask, who did you consult to? Is there, have you faced any problem? I might go do these things. But have you actually spoken to a healthcare practitioner or a doctor and asked this thing, that is there a communication gap from your side? If someone contacts you through an app, or if someone is reviewing you through an app, does that help you in any which way? None of the entrepreneurs have actually do that. They are always thinking from one in a silo, from a customer point of view or from a patient's perspective, and never from the doctor's perspective. So when you're taking 50% of the people out of the equation, either a hospital or a doctor or any other healthcare practitioner, and you're trying to form a solution without involving this 50%, the solution would never be the right one or the scalable one or being implemented to your best capabilities. And that's what happened. In today's scenario, you will still see that this patient, the problem still exists. There will still be patients complaining about this communication gap or about this, getting the access to the best doctor, and the doctor still feels that, it's fine, for me, I need the patient to come and see. So it's been donkeys of years and we are still circling around the same problem because identification of the problem hasn't rightly been done. Is the challenge in reaching out to the doctor in the quickest possible way, or finding the nearest doctor, or finding the best possible treatment, or is it an emergency or not? Since there are so many gradients of actually understanding the problem, gee, the way to actually implement a solution without thinking of all these gradients is where most of the health tech startups fail. The second or the third could be, from a healthcare perspective, there are multiple challenges, solving this tech barrier, that the data. I have last 5 years of my reports, multiple places, emails, hard copies, some files and folders and this and that. And then I met a lot of startups which were, that like, we are going to collate one data, we are going to collate this, there will be an app where all your data will be stored. I said, okay, fine. You are telling me as a patient, I can do that. Fair enough. that I am, say, if I'm tech savvy and as a patient, I go, I scan my reports, I label them, I or wherever I store them, or even if I click a picture and it automatically gets transcribed into some sort of a digital locker or something, that's fine. How will a doctor gain access, or why will a doctor? And that was the second point. Okay, once you go there, you just give this access to the doctor, and the doctor will automatically open and start scanning through them and start seeing them. No, they never do that. So again, the challenge being that all problems are being solved from very one-sided perspective rather than taking the whole ecosystem. The second option was that the doctor itself starts, or the hospital itself starts scanning, operates a system. Now, India being the huge country that it is, with 10,000 people working on at 100 different levels, having one integrated system is almost next to impossible unless the government steps in and makes something like a passport or a driving license or a
Mhm.
Aadhaar card or something of that sort, which they haven't done, for healthcare. Healthcare itself is fragmented in terms of how do you get to know where I got treated? You are working, you stay in Indore, you might have got treated, but if you flew down to Delhi and you fell sick, you got treated at a Delhi hospital. Can that two data ever be synchronized and brought into one common platform? Never ever that happens. Even in the same branch, I'm telling you that if
Mhm.
you go to the same branch of XYZ hospital at Indore and Delhi, that data will also not be synchronized.
For me, the biggest challenge has been the fact that we are trying to solve uh, a very complex problem. It's not simply just a doctor and a patient, it's a whole ecosystem itself. Easier said than done that when you enter a hospital premise, are you a cash patient? Are you an insurance patient? How much insurance is actually covered? To what disease these is the extent? Will you ever get the insurance back or not? If you are actually a panel patient and if you want to get the best kind of treatment, does the hospital has that other panelment or not? Which doctor do you want to? Is that free or not? Do they actually? So from the complexity perspective, it's not as simple. Drive in, there is a list of menu. You choose a burger or a pizza, and then it's prepared. So there's no one possible option that you have to select, and that's where the complexity of the system comes into. Our government, though, may have tried to implement Ayushman Bharat and give one kind of insurance to everyone and caters to, but again, that has also not been implemented across India. In a few states, and not all the hospitals do accept Ayushman Bharat. So this is just in telling you that we have such difficult myriad various possibilities to the challenges that we have, that it's not easy to actually solve that through purely a technological point of view. For me, any startup working in the Indian healthcare system, instead of tackling the major problem or massive problem, choose a very simple problem, say for diabetes itself, or infertility itself, or oncology itself. Choose that one specialized problem and see that how can you actually help. As I said, the three pillars: the accessibility, the awareness, the affordability. For oncology, neurology, cardiology, any specialization, just on these pillars, how can you make a patient's life better, making the treatment either more affordable or accessible, or going behind our step further back than that, making a patient aware about how not to fall into that trap. Preventive care, which does not exist in India. An Indian ecosystem works in the fact only that, oh, आप बीमार हो गए, चलो आप चेकअप करा लेते हैं. You are an informed citizen, Nilesh. If I ask you, do you actually get your annual checkup done, or to one every 6 months? Are you that well aware that you ensure that you're getting all your parameters checked so that you know what needs to be controlled and what needs to? Even if you do, we have 142 crore people, and I'm sure that 100 crores don't even are nowhere near to that thought process or having that bit of awareness that this needs to be there.
Yeah, so tell about the if any particular healthcare startup you are working which is doing some particular work.
So I work with a lot of HealthTech startups primarily in my field, like Infertility Doors, Best to the Baby Bump, Glamio Health, Prognosis, Progenesis, multiple startups, involved into very different fields. Say someone into in our industry only, which is the infertility industry. Some with rural healthcare, trying to solve the problem of accessibility for tier 3, tier 4 towns, trying to get accessibility over there. Startups like probably Glamio Health, which is on a similar model to Pristine Care, where they are trying to solve the affordability problem, that if you have a surgery, but if you want to do it at one third the cost of what's done in a corporate hospital. So I've been through the spectrum, and I feel that the healthcare challenge, as I said, it's so huge and so immense that uh, none of the startups have been able to crack that. The poster boy of our Indian healthcare ecosystem was Bracto, which was there for which has been there for a very long many years. Uh, but you would see that, in every other industry, becoming a unicorn takes 2, 3, 4 years at the max, with the amount of capital that any startup gets to have. But in the healthcare, I mean, you you might probably see a health tech device becoming a unicorn rather than any healthcare startup. Practo itself is not a unicorn. Pristine Care, which became a unicorn, is having its own headwinds and own challenges. So if there are 120 unicorns in India, healthcare would probably only have one or two, and you can actually see the big divide over there. That what is so challenging? I mean, why don't healthcare startup we are able to scale or raise that much capital, whereas any other startup in any other industry is able to scale that easily and do something great? So that should give you an answer that problem is so complex that people who are trying to solve that complex problem are not hitting the right track, are not on the right direction, or they are the way that they are implementing the solution needs to be different. It's not the right methodology. It's not the right vision and strategy that they are actually taking place as of now.
Yeah, yeah, yeah. Yep, I understand that because we work with a lot of healthcare startups out of US, and we are developing the products and the platforms for the US ecosystem. And definitely the problems in Indian ecosystem are different and unique as compared to what they have, because they have gone further in the innovation of the technology or of the ecosystem. Though the medicinal things are similar all across the world, but the systems and the way people are being treated is has taken a leap in the other parts of the world. And I think our Indian startups are also trying to get into the latest and the greatest of the technology foray. And is any of your startup working on the AI thing, AI innovation?
Yes. So with AI itself is a complex issue, but a few startups which are in terms of conversational AI that we are trying to diagnose and figure. In my industry, I'm working with one of the startups which say our industry is the info IVF industry, where we make embryos and we make multiple embryos in a cycle, choosing which of the best embryo is still done. If it's done manually, it's just left onto God's will to who will the embryo implant or will the implantation be successful. So here there are a lot of startups have been involved in choosing the using AI models, learning about the images, the growth pattern. So it's in a very beautiful and a scientific way. When one cell becomes two, two becomes four, four becomes eight, eight becomes 16, and henceforth. So when AI models are observing this, seeing the growth rate, the fragmentation, the pick through multiple pictures, observing everything, and are able to actually give a score on the probability of success, that this embryo implantation would be is probably 90% compared to 40-50% compared to the other embryo. So this is one of
Mhm.
the interesting AI startups in our field, our industry, which is helping us probably not get more twins or triplets, and save the patient the complex challenge of having a failed IVF cycle and then trying again, improving the success rate in a very simple way. So no doubt about that AI is a game changer and will help in whatever way. So from this is in our industry, conversational AI in which you can actually, people tried that, but that was too vast a problem. One of the startups that was working with me was trying to, develop this conversational bot where you're telling the symptoms and it'll keep narrowing it down. But it was skewed because unless you have empirical data being fit right into it, and even though the startup was advanced, that is going to click, it's clicking pictures of the face, trying to judge the soreness, trying to uh, trying to judge your multiple facial recognitions patterns, and then giving out a score and figuring out what. But it was, the data is too vast and too polluted. Probably it was ahead of its time, and that's why they could not succeed. Like what, trying to create a chat GPT model of your medical symptoms and then giving you a narrowing down the brief disease that it might be. Is it purely fever? Is it viral? Is it bacterial? Is it all of that? So putting the data into a model is easy, but getting the exact correct output in healthcare is not correct through AI right now, because you require more empirical data, you require the touch and feel, you require a bit of experience to know the difference between a very fine line of difference, say between a viral infection and a bacterial infection, which cannot be just done by a conversational AI. So, in healthcare, the AI models are immense and will actually help. But at what point of healthcare is what we are seeing right now? So, for me, there is immense scope in healthcare. Too much to be done, and too few people working to solve these challenges.
So when you are like you have been working with so many startups in healthcare, outside of healthcare as well, and we have worked on many startups in the lifetime of our company. In totality, we are startups. The startups which we have worked have cumulatively aggregated around $150 million of investment, and
Wow, that's
many
great.
of
That's
them are,
great.
but there are so many failures as well. So it is like two sides of the coin. So what is your take on, your opinion on why do startups fail, in your in the startups where you have invested? Did you see that there were startups who failed?
No, so again, healthcare, unlike other products, healthcare is not. Uh, it's a challenging issue because, firstly, there's lack of infrastructure and accessibility. When I have encountered myself, when I said that was my strength, that when a lot of people came to me and they required patient data, nobody, no hospital, not even a chain of clinics or anyone was actually willing to share patients' data. Even if though that data would help someone model their whole,
Hmm.
the whole product on or the whole service on, that data will actually help them providing a beautiful solution down the line which can act as a preventive care. But no hospital, no doctor, no healthcare professional is actually able to want to share that data. The second, I mean, that's one of the core issues. The second is healthcare has a lot of compliances. Um, Anybody that's working in the healthcare sector, you need to have as I said, patient consents, the approval
Sense.
from the insurance authorities, the approval from the healthcare providers, the approval from the Food and Drug Administration. Everywhere it is so complex that before actually solving a healthcare issue, are you compliant enough to even actually solve the issue? The compliances and hurdles are so much in the healthcare system that the implementation becomes a challenge. So the lack of
Hmm.
resources and the regulatory and the hurdles are two factors. The third obviously is that the support given by our own healthcare practitioners and our own willingness to actually go through the data and give through that. I believe doctors themselves are partly to be blamed over here because their willingness not to probably share the patient data. Even if you see that in terms of the papers that we publish, it's all done in that there was a study of 100 patients and these were the results,
Yeah,
and
I know,
and
I
that's
know.
it. You're never going in depth who was there, the demography, the age, the who are the patients from, what are their names, their addresses. None of that is ever disclosed. So we have never been able to find a global solution to a local problem, or vice versa, a local solution to a global problem. I actually believe the solution lies only in finding the local solution for a local problem. Let's our startup mix and match with the problem of being either being local or being low globe. So they're trying to actually find solutions to Indian, from an Indian startup perspective. You need to find solutions for the Indian disease, for the Indian diaspora, rather than
Hmm.
trying to find a solution for a Western disease in the Indian ecosystem, or trying to give the Indian solution to the Western ecosystem. If you're looking at diabetes, look at diabetes only for Indians, and what do is it our mithais, is it our North Indian mithais, our South Indian mithais, our jalebis or what or not, or is it the atta, or is it maida in our system? Again, everything is different. Our breakfasts are different, our lunches are different, our dinners are different from the any perspective, and it's different from a south to north, from a east to west. They are different. So how can you try and find a one common solution to all the problems? Because healthcare does not work that way. Every body reacts differently to every different food type, and every challenge is different. For me, hair fall is different. For you, hair fall is different. At 25, I'm having hair fall, and at 35, you're having hair fall. They're because of different reasons, different symptoms, different environments that we live in. So finding one common solution to that hair fall will not work. And that's where I constantly tell, let's figure out what solution. That there is no one particular oil or shampoo that can fit you and me together. It has to
Hmm.
be different. And healthcare works on that different methodology only. So that was my advice to all entrepreneurs who used to, we used to have these discussion sessions and those mentoring sessions where we would go deep into the problem, that healthcare cannot be solved through one product or one service. It has to be streamlined into multiple different products for multiple different problem statements rather than one solution fits all.
Mhm. Yeah, I agree. The data is one of the big problem because for any AI model or intelligence to work on, you need huge amount of data. And though we have lot of data because of the and we have variety of data because of the diversity in the system, but the problem is people are not sharing this data to anyone. The healthcare systems do not want to share the data. Insurance doesn't want to share the data. And for any innovation to happen, we need that data. So I agree, and this is a constant struggle. We are currently working on predictive some analytics on cardiac patients who have implantable devices like pacemaker. So we are trying to get information about how the from the pacemaker, the information which is collected by these people like Biotronics, Medtronics, St. Jude, and all. Out of that information, every information is important, and how they are related, so that if an AI model encounters those kind of situation, we can alert the patient, alert the nurse, alert the doctor beforehand, rather than the patient after the episode happens goes to uh, get the checkup with the doctor. So we are trying to work on that model, but unfortunately the data is not available. So, but we have worked in other countries for the cardiac patients. So we have some amount of data. So we are using that for training our AI model and all that. Okay, so you are investing in a lot of startups. So I just wanted to know, like, what is your deciding factor? How do you decide that this is the startup which is interesting, sexy to like it?
I mean, everybody wants to build a cool product. and startups. You meet so many young people, students, young college going entrepreneurs, who just want to do startup because it's cool to say I'm in a startup. It's not cool to say here I will join my father's manufacturing business, or I will work in Infosys, or I will work in any MNC. There is no wow factor over there. So that's why everybody wants to do a startup. And whenever I meet these students, that's where I say that you'll never be successful, or your startup will never be great because the reason is wrong for you to jump. You firstly did not identify a core problem. You haven't done your market research. You are not actually trying to solve any large scale or any small scale problem through proper validated methodology. There are so many startup tools which I actually want every founder to go through, which is like business model canvassing, your product market fit. Once you've gone through those cycles, once you actually have that thought clarity, then go for the implementation. Most of these founders are actually go either right. So I found the problem and this is the solution, missing the whole actual problem solving stages, that what is the canvas that you are looking for, what are the threats and analysis, what would be your strengths and weaknesses, what would be the implementation challenge, is there a big enough market, is there a big enough market who's actually ready to pay you some money for it. Nobody goes through that. They actually have this coherent belief that I will launch this product and I want to get investors money. Most 90% of the startups are actually not looking to actually reach the solution. They're actually looking to reach to investors' pocket and getting that money because that gives you claim and fame. So instead of working on that, instead of being a problem solving great startup, it's mostly a fame to claim, and that's where I believe that a lot of startups, students, and some entrepreneurs are going wrong. When I'm looking at startup, I'm looking at people. They don't necessarily have to be from IIT or IIM. They have to have that big fire in their belly, which should actually tell that without, if they can actually make money with no money, then they can actually make money when I give them money. I constantly say that it's not a lack of resources, it's a lack of resourcefulness from you. In today's scenario, probably when you started or I started 10 years back, there was a resource crunch. We did not have access to VCs, incubators, accelerators, angel investors, all of this. The ecosystem wasn't there. Now, with these kind of resources,
Yeah,
if you're still struggling, there is something very wrong with you, or you don't either have the hunger, or you give up too easily. You don't not ready to slog it for 8 months, constantly banging on the doors of investors that okay, not this one, okay, you rejected me, I'll go to the next one. You rejected me, I'll go to the next one. If you rejected me, I'll go to the next one. Because if there are 5,000 startup people, then there are 3,000 investors also these days, or you say 1,000 investors. But people give up within the first two, three, four tries because everybody wants it easy. So for me,
yeah.
I'm actually looking for those hungry founders because I believe that I'm not the best investor and my thoughts are not the more, will always not be correct. I can only gain from my experience. But if certain people are ready to actually challenge me, no, sir, we will actually show you that there is a market for this product. Our services are required in the ecosystem. We will actually. So those kind of hungry people will prove eventually everyone wrong. And those are the kind of people that I'm looking for, that I may not be able to give them the best advice, but they can actually prove everyone wrong and prove that they are right with their product if they're hungry enough. Because eventually, hard work hard work and perseverance beats any kind of talent in the world. So I don't want the most talented people. I'm looking for the most hardworking and most persevering people in the world.
Excellent. And I caught the line that there is no resource crunch, but the missing resourcefulness in the individual. So the
It's not.
fire is
It's not a
missing.
lack of resources. It's a lack of resourcefulness.
Resourcefulness. Yeah, yeah. That is a catchy line and a very interesting advice to all the startups. And definitely, people need to be passionate about what they are doing rather than passionate about getting investment. and which actually eventually do not happen, because if you are passionate about what you are trying to build or what problem you are trying to solve, makes a lot of difference, and that gives the confidence to the investor as well.
Yeah.
So interesting talking to you, Sarthak, and thank you for being at the show, and very good advice to the healthcare ecosystem and to the startups. And thank you very much.
Thank you, Nilesh. Thank you for having me here. It's a pleasure. And I look forward to interacting more often and look forward to collaborating wherever we can in for your US startups and for our Indian startups.
Sure,
Sure.
definitely.
Yeah.
Okay, thank you very
Thank you,
much.
Nilesh.
Yeah.
Thank you. Pleasure.
Okay, bye. Pleasure.